Hi and welcome, my name is Julie and I'm going to deliver a presentation on the roles and responsibilities of a registered nurse. I will cover the recent changes and their impact on the roles and responsibilities of the registered nurse, the role of the Nursing and Midwifery Council in relation to nursing practice, the implications of the Code on Nursing Practice and the role of the registered nurse, the need for effective communication in a multidisciplinary healthcare setting, and the effectiveness of the multidisciplinary approach in a healthcare setting. The recent changes and their impact on the roles and responsibilities of the registered nurse. First of all, what is a nurse? Before becoming a registered nurse, you will have to gain a university degree, have a good health and be registered with the NMC. Nurses play a critical role in healthcare. They provide medical and nursing care to many different patients in different healthcare settings. These can be hospitals, GPs, GP surgery or primary care settings. Nurses are often the first to detect health emergencies and work on the front lines of disease prevention and the delivery of primary health care, which includes promotion, prevention, treatment and rehabilitation. Nurses must have the core values set out known as the 6 C's. These are care, compassion, courage, communication, commitment and competence. Nurses who operate on these values ensure that the job gets done in an effective and efficient manner and patients are safe and well treated. Since the beginning, nurses have been associated with caring, nourishing and nurturing. These were seen as female responsibilities and to this day there are more female nurses than male. Two reasons for this could have been gender stereotyping and low paid salaries. There are many changes that have impacted the role and responsibilities of the registered nurse over the years. Some of these are political, economic, social, technological, scientific, organisational changes, professionalisation and policies. I will talk about some changes from some of these. There are more nurses than any other profession within the NHS. Unlike many years ago, nursing is now a profession and there are laws, principles and standards to follow. The NMC Code 2015 is a set of standards that nurses must uphold in order to be registered and work as a nurse. The NMC ensures nurses are up to date with the knowledge and skills and are fit to work. Through this, nurses are more able to deliver safer care and meet the needs of patients, and care is now more person-centred. In 1946, the government brought out the NHS Act. This was the birth of the NHS. Many health professionals now started to work together under one service. Nurses and other health professionals became accountable for their own actions and decisions in patient care. People at this time did not see the true value of nurses and thought of them more as the doctor's assistants. But over time, due to laws and policy changes, nurses' roles began to change. Nurses' responsibilities started to change when more extensive training became available. Nurses were now starting to be trained in things that other professionals were doing, giving them more freedom to do other things. This meant that nurses were able to start making decisions of their own in patient care. Nurses became more respected and nursing degrees were brought in. To become a qualified nurse, you must do a degree at university for 3 years, and this still stands today. Nurses are now seen as their own profession and not a doctor's assistant, and now have extensive medical knowledge and skills. Now that people are living longer, there are more medical needs. This also comes with rising cost. Through clinical guidelines, protocols and patient pathways, patients now know more and can question nurses' decisions. This puts more pressure on nurses to make sure they have the right skills and knowledge when dealing with each patient. Nurses now need to admit to any mistakes made and face sanctions. This provides transparency and better patient outcomes and less mistakes. Knowledge and skills are regularly being updated, making sure nurses are more competent. The Modernisation Agency 2001 was launched to lead the NHS improvements. Its role was to support modernisation of the NHS, which would improve patient outcomes and experiences of their care. Nurses were trained on more skills and their roles were matched to the skills they have. This gave them control over their practice, which also led to less mistakes, better patient care and job satisfaction. The NMC. Now let's discuss the role of the NMC. The NMC stands for Nursing and Midwifery Council. Once a student has finished a nursing degree at university, you must register with the NMC. This allows you to practice as a nurse. First, you will need to apply to the NMC. Then once you have received confirmation from them, you will need to pay and take a test. Revalidation came into practice in April 2016. Nurses need to revalidate every 3 years. This is to help you reflect on your practice and see how you can develop and improve. Revalidation also gives assurance to patients and the public knowing that nurses are up to date and fit to practice. The NMC came into being in 2002. It regulates nurses, midwives throughout the UK and nursing associates in England. They promote high education and professional standards for nurses and midwives. They make sure that nurses are up to date with the knowledge and skills and are working at professional standard. At the moment, they support more than 771,000 nurses. The NMC set professional standards and behaviour under the code that registered nurses must uphold. Nurses must also follow the professional duty of candour. This means nurses need to be open and honest with their patients when anything has gone wrong with their care. They must also let their colleagues, employer and organisations know and be cooperative to investigations and reviews. The NMC promotes all healthcare workers to speak out about any concerns they have and feel supported doing so. They deal with many things such as concerns and complaints. They investigate allegations made against nurses and midwives and act when needed. Depending on the outcome of the investigation, the NMC has a sanctions guidance for the panel to follow. The NMC can issue cautions for 1 to 5 years, impose conditions of practice for a period of up to 3 years, suspend the nurse, midwife or nursing associate's registration for up to 1 year, strike off the nurse, midwife or nursing associate from the register. The implications of the code on nursing practice, the role of the registered nurse. So what is the code? The code is the professional standards and behaviour that nurses and midwives must uphold. They are non-negotiable and can be applied in all different settings. There are 4 aspects to the code. These are prioritising people. You must put the interest of people using or needing nursing or midwifery services first. Make their care and safety your main concern and make sure their dignity is preserved and their needs are recognised, assessed and responded to. Make sure that those receiving care are treated with respect, that their rights are upheld and that any discriminatory attitudes and behaviours towards those receiving care are challenged. Practice effectively. This means assess needs and deliver our advice on treatment or give help, including preventative or rehabilitative care, without too much delay and to the best of your abilities, on the basis of the best evidence available and best practice. Communicate effectively, keeping clear and accurate records and sharing skills, knowledge and experience where appropriate. Reflect and act on any feedback you receive to improve your practice. Preserve safety. You must make sure that the patient and public safety is not affected. Work within your limits. Work within the limits of your competence, exercising your professional duty of candour and raising concerns immediately whenever you come across situations that put patients or public safety at risk. Take necessary action to deal with any concerns where appropriate. Promote professionalism and trust. As a nurse, you should uphold the reputation of your profession at all times. You should display a personal commitment to the standards of practice and behaviour set out in the code. You should be a model of integrity and leadership for others to aspire to. This should lead to trust and confidence in the profession from patients, people receiving care, other health and care professionals and the public. If these standards are not met, the NMC will act accordingly, and in most serious cases this can mean being removed from the register. Failure to meet these standards can mean patients' needs will not be met and can be detrimental to them. Having the code to follow is an important part of nursing for many reasons. Some of these are: it reduces harm to patients, provides better care by putting the interests of the patients first, provides safer care and promotes trust. It also makes nurses more aware of the things they have done wrong and work on them. The code provides a clear message of what is expected of nurses. Nurses need to revalidate every 3 years, and when doing this they must commit to upholding the standards set out in the code. Nurses must have their own accountability for the professional judgment and the care they provide. If a nurse feels like she cannot do her job and failures may occur through things out of her control, for example staff shortage or not having the right working commitment, she must raise these concerns to the correct person as soon as possible. Under section 16 of the code, nurses must act without delay when there is a risk to patient safety or public protection. Failure to do so puts the nurse at risk of failing to uphold the code and consequences will be faced. It is inevitable that there will be complaints made. Nurses are expected to be fit for practice by the public and they are trusting them with their health. If for any reason they were not, many things could go wrong, and this is when complaints start to happen. There are 4 main categories that complaints fall under. Lack of competence. This is errors happening over and over, poor standards of communication, not correctly working as part of a team. Misconduct, theft, verbal or physical abuse or poor care. Bad character, any type of criminal behaviour. Ill health, long-term health problems that are not being treated and managed. If the nurse is upholding the code, these things should not be happening, and thankfully happen less because of the code is here. An explanation of the need for effective communication in a multidisciplinary healthcare setting. Communication is extremely important in all healthcare settings to meet the best healthcare needs of the patient. Multidisciplinary teams work together. They are a team of healthcare workers from different professions that provide specific services and complex care needs of the patient. A care plan is made for the patient, and communication is a must for the best care to be delivered. Each professional on the team should know their own role and responsibility in respect to others. They should all have the same goal and be working towards it. Although it is a shared responsibility to reach the goal, everyone is responsible for their own actions. Communication is a big part of the code. This is because nurses are dealing with patients and professionals all through the day and must be able to keep others informed of the patient's care so mistakes don't happen. Having good communication, you will be a good listener, have good body language, be non-judgmental and honest. You must be able to access each situation. You must be able to assess each situation you are in and adapt. Be able to speak clearly and be understood, meet any language barriers and support the needs of the patient. MDT is focused on a person-centred care approach. They are focused on the needs of the individual and what their preferences, needs and values are, and the person is treated with respect, dignity and compassion. Compassion is the core of the NHS values, and all nurses should practice this. Compassion plays a key role in communication. Compassion gives many different positive outcomes. It can speed up recovery and prevent health problems. It helps build trust and safety through listening, understanding and responding with a caring approach. The more trust that is gained, the more the patient will have better health outcomes and willing to listen and cooperate in their care. The effectiveness of the multidisciplinary approach in healthcare setting. The multidisciplinary approach to nursing is positive and effective in many ways, but also has its limitations. A multidisciplinary team is made up of different professions. They work together to meet the needs of the individual and provide the best possible outcome of care. For a patient who has many different needs or complex care, the multidisciplinary team provides comprehensive care for each need. With all professions working together to reach the same goal, the needs of the patients are more manageable. As there are many professionals working together, the decision of which treatment is right for the patient will come from more than one person. Although the disadvantage to this is there could be some confusion or personality clashes, therefore many disagreements before the agreement is made. But I still believe by doing this there will be less mistakes and better care, because as professionals from different backgrounds, they will have different expertise and have seen many outcomes. Because there are a lot of professionals working on all areas of care needed, the patient will have more confidence, but sometimes there are so many, some professional ideas may not be heard. This could have a negative impact on the patient's care and take longer to meet their needs. Although that may be the case, the most important needs will be dealt with first. All the professionals working together must be able to communicate well for things to work and understand their own role and what is needed from them. Without this, many things would go wrong and care needed being missed. Another good thing about having a multidisciplinary team means the patients who need to be referred for specific treatment will already have involvement with the person who deals with that, and the team can work together to get things moving faster and the necessary treatment started. In my opinion, this will give patients better chances with their health needs overall. I believe having the multidisciplinary teams is a real benefit to the public in need of treatment, and although there are negatives, the positives outweigh. That's the end of my presentation. Thank you for listening.